Now I'm going to discuss the TMJ. It's a very important joint here, just in front of the ears here. If you open your mouth and close it, you'll see the joint movement, and you'll feel the joint movement, and that will show you where the joint is. Now what happens is, now this joint is like that, there's a head of the joint and there's a capsule here, and it's located here. So when you chew, you talk, you yawn, it moves all the time. Now sometimes when you grind your teeth at night, this constant grinding of the teeth, and especially when you're stressed, the jaw muscles, they get very tight. Because of this, the joint gets eroded. There's a wear and tear there. This, whenever you're angry, this is part of the animalistic reflex to bite, when you're angry. So this jaw muscles get very tight, and this continuous sort of rubbing of the joint, the cartilage gets eroded, and the joint itself gets inflamed. So you get pain here. Now, you also get problems from eating a lot of steak and hard things, nuts, a lot of nuts, and chewing gums. All these cause this problem. And then, because of that, you get pain here locally sometimes. Sometimes this mimics earache. You feel as if your ear is aching, and you often go to a doctor, ENT specialist, to get this sorted out. But it's due to the joint. It's got nothing to do with the middle ear, which is a painful thing as well, but it's a different type of pain. And then you get one-sided headache. Many of the one-sided headaches are caused by this temporomandibular joint. Of course, you can get dislocation of the joint when the mouth opens and you can't shut. Then you probably need a little manipulation and all that, to get that fixed. But to treat yourself at home, you need to do a few things. I'm going to show you that. We treat TMJ like this. So put your fingers on top of the temporomandibular joint. To test it, ask the person to open the jaw, and close it. Open, close. So you look for a place where there's maximum movement, and you put your finger there and massage the joint. It will be quite painful, but massage the joint like so, applying pressure into the joint. So you do that for about 5 minutes, right? Then you place your finger, index finger, inside the joint, inside the vestibule of the ear, and then massage it from the other side, from inside. It will also be very painful. Massage it from here. Keep massaging it. Also for about 3 to 4 minutes. First you do here, and then do the inside your ear, and then you massage this area, masseterica, this muscle here. It helps in the biting reflex. Then the most important thing is to massage the jaw muscles here. Go, massage it all round, quite deeply. It will be painful. This also you should do for 3 to 4 minutes. Here, 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 and the jaw muscles. Okay? And after doing that, you use the poultice. So take some salt, heat it on a frying pan when it's fairly hot, pour it on a piece of cloth and tie it up. If it's too hot, put another layer of towel to start with, and you do the fermentation here, right here, press it. 1, 2, 3, 4, take it away. Give it a chance to cool down a little bit. 1, 2, 3, 4, move it. Because if you continuously sort of push it into the tissues, you might cause a first degree burn. So you keep doing that and out. 1, 2, 3, 4, and out. 1, 2, 3, 4, and out. So you place the heat directly here. You could also put some of the heat here in the jaw muscles, but it's better to focus on the TMJ joint, TMJ, because that's where the problem is. And the more you ferment, the better it gets. So you can do this 3 times a day. This is where the trick is. If you go to a therapist, you do it once a day and then you're called the next day or something like that. No, you got the problem and you try and get rid of it. Sometimes dental work, after dental work, a lot of dental work, with different types of interventions in the teeth. The jaw, the dentist asks you to open your jaw and they keep on working on it. You injure this joint. It happens all the time. So you must immediately have this treatment. Even if you don't have the pain on that particular day, you do the damage control then and there. It's very important because dentistry does aggravate this condition, and they're trying to study the causes of TMJ pain, and a lot of dentists, they have seminars going on and all sorts of discussions on this. But mouth guard is not the real problem. They give you mouth guard, they measure up, and it just relieves the teeth from being ground like that due to this constant pressure, due to bruxism, spasm of the muscle, which leads to the pain here. That's the link. Do that, and the exercises you do is to open your jaw, close it. Open your jaw, close it. Open your jaw, close it. This you do for about 20 times, and you can also take your jaw left and right. Here. It's also about 20 times. So do this 3 times a day, and the pain will go quite quickly, and your headache, of course, will go immediately. You'll get a relief from one-sided headache. This is what I would recommend for torticollis, when your neck is twisted in one direction.